All right, Dr. Shine, 1 minute away, all right? All right, hello again, everybody. Derek Steyer here with another 640 special on Facebook. Tonight's topic is coronavirus or allergies. And joining me tonight is Dr. James Shina, who is an Austin-town allergist. He's been in practice for 15 years. 15 years, right, Dr. Shina?
Yeah, 15, internal medicine.
Yeah, internal medicine. Yeah, thank you very much for joining us tonight. We appreciate it. If you have a question for Dr. Shina, you can put that into the comment section here on Facebook. We got a lot of folks watching, a lot of people interested in this topic, doctor. So the big question right out of the gates, how do we differentiate between symptoms of allergies and symptoms of coronavirus?
Good question. The problem is that the two sets of symptoms, are very different. But up front, coronavirus, when that starts, can look like a lot of different things. The initial symptoms of coronavirus can range from, runny nose, sore throat, to diarrhea, to loss of taste, loss of smell, to, cough, shortness of breath, fever. Allergies typically would stay, clear, runny, nose, watery eyes, itchy eyes, and doesn't really change much. Allergies really don't give you fevers and shortness of breath unless you get really congested. So up front can look kind of similar, but as it goes on, they're definitely not similar at all.
You can certainly see a case, though, here where people are going to be pretty anxious. They're going to be really curious and maybe a little fearful here if those start to kick in.
Oh, absolutely.
Yeah.
There's a lot of fear out there. I'm on hospital rounds this week, and we're seeing more and more cases every day. So it's a little nerve-wracking. But one of the things I tell my patients is just pay attention to your body. You know your body better than anybody else. Fever seems to be the most consistent symptom with coronavirus, as well as the cough. But when you start getting short of breath, that's when it starts potentially getting a little more serious. But the majority of people that get coronavirus either have no or mild symptoms, which could look like allergies. But when we see it progress to where a little bit more, serious, I feel a lot worse, then that's when you got to tell somebody.
I've seen some people ask the question, can people have both allergies and coronavirus? Dr. Shina, if I can, let me pause you real quick. Yeah, we lost your mic.
Okay.
Oh, there you are.
Now?
You're back. Okay, so
Okay.
start over from the beginning of the question if you can.
Yeah. So patients that have some underlying issues like asthma or emphysema, they can get a little more trouble with the drainage, and stuffiness you get from allergies. Just like with coronavirus, they're higher risk than those that don't have those conditions. But basic allergies, again, the runny nose, itchy eyes, maybe a little sore throat, maybe a little chest congestion, and it lingers for weeks and weeks. Coronavirus right now seems to, if it's going to hit you, it's going to hit you within a couple of weeks.
Dr. Shina, I see one question here on Facebook from Deborah that says, how long does the loss of taste and smell last even when you're getting better? Are you able to answer that question by chance?
So what I've seen, it's actually been a very interesting symptom and something that we're able to differentiate between other issues, just like basic sinus infections or bronchitis or even allergies. Typically, it's a few days. It's something that's one of the first things to come back. in my experience so far, which is, again, limited to the last, 4 weeks or so. But that's one of the first things to come back, 3 to 5 days.
Ken, Dr. Shaina, Ken on Facebook wants to know, at what point should you call your doctor?
What I'm telling my patients is, somebody where it sounds like coronavirus, like again, the loss of taste, loss of smell has been kind of one of them flags that we're seeing. And the fever, like I mentioned before, that's just, again, the most consistent symptom. I'm having them call every day, every other day with updates. And absolutely, if you think that you're getting worse, there's, if you're staying the same, using over-the-counter remedies, feeling okay, it's good to update, but something gets worse. Brand new symptom you're not comfortable with, you got to call. Where we're seeing some people get into trouble is they're waiting days of, I'm short of breath, I can't breathe, I feel like I'm breathing shards of glass. Those are the kind of things that we're hearing when people are getting into trouble.
I'm not sure if you mentioned this earlier or not, but can you run a fever with allergies?
You really, allergies by themselves, you really don't. I'm sure you can find some reported, but it's just really, now allergies can lead to, generally to mucus, congestion, and if that leads to like a sinus infection or a bronchitis because you're not clearing that stuff out, then you can get a fever indirectly. But allergies by themselves, you really don't.
How about over-the-counter medications? Do you have any recommendations?
Yeah, Tylenol is always safest for sore throat, headache, muscle aches. There's some anecdotal evidence that came out about whether anti-inflammatories like ibuprofen or naproxen, which is Aleve, are less safe, make you more prone to getting sicker with coronavirus. That hasn't been substantiated. Still, though, Tylenol is still always the safest in most people. Some of the combination meds that we have that they for has decongestants in them to help dry up your nose, antihistamines to dry up your chest, cough suppressants. They're all, any of those are generally safe. Older individuals that have, especially some heart or blood pressure issues, you have to be careful, especially with anything that has Sudafed in it. So that's on an individualized basis. But, most of the kind of remedies do help with the basic symptoms of both allergies and even early coronavirus.
It seems that fever is a key symptom of coronavirus, and Laura on Facebook is asking specifically about that. Dr. Shaina, is fever a key symptom?
Yeah, I mean, it's been the most consistent and it's persistent fever. Some of my patients that I know have it. It's just this fever, no real cough, no real headache, maybe some aches, but it's fever. This fever won't go away. That's been, the big red flag that I've been seeing.
Shayna on Facebook, Dr. Shaina wants to know if allergies mess with your asthma.
Sure, yeah, especially with the congestion and, depending on what you're allergic to, that could, it could be a trigger for asthma attacks in some folks, yeah.
And having asthma is one of those underlying conditions that could be problematic for people in getting coronavirus, correct?
Well, yeah, patients that have asthma are higher risk for complications from coronavirus just because it's a respiratory infection.
Right.
And asthma, between the constriction of the airway and the inflammation in the airway, both of those things can get triggered by any respiratory virus, including coronavirus.
Do you have any tips for people who are allergy sufferers during this time of fear and going through this pandemic?
Yeah, don't panic, but pay attention to your body. Generally, people that have allergies know exactly what they feel like, and they're going to deal with them every year. If something doesn't feel like your typical allergies, you got to tell somebody. You got to call your doctor.
I'm curious how people figure out, and I saw that forecasters are calling this a brutal spring allergy season. And I'm curious, how does it come to be whether this is going to be a good allergy season or this is going to be a bad allergy season? Is that something you can talk about?
Yeah, it seems like every year is a brutal allergy season, especially for those of you that have allergies. The problem is that there's a mix between the indoor allergies, so like dust mites and certain fungi, cockroaches, animal dander, and your outdoor allergies, which is most of your pollens and your trees and your grasses. So when we flip between this hot and this cold, warm and cold, I should say. It gets colder, you stay indoors, you still have those things kicked up, and then it actually gets warm outside, and the pollen starts kicking up, and the grass starts to grow faster, and the trees start to leave, and then you're getting hit both sides. I mean, I think every year for the last few years, if you look at our allergy forecast, our pollen levels have been highest in the country, in this just general part of the country.
Jake on Facebook says, will the sudden changes in weather over the past 1 to 2 weeks, will that have any issues with sinuses and allergies?
Yeah, sure.
Yeah.
Yeah, just like I mentioned, I'm sure within the next month I'll be getting a lot of calls for stuffy runny noses and chest colds.
Dale on Facebook wants to know, are the percentages of coronavirus deaths larger for people with allergies? Any data to suggest that yet?
I can't comment to any data. Just going by, just basic medicine, I would say no, unless it's associated with other, disease states like asthma or emphysema, heart failure, things like that.
If you're a lot of people are staying home, but if you're an essential worker, you have to go to work. You're suffering from allergies. You don't want to cough or sneeze because then you get looked at by your coworkers. What do you suggest for those types of folks?
Same thing. We're telling everybody with any kind of symptoms is basic hygiene. Coughing. You're going to have to cough and sneeze at some point. Cough and sneeze in your sleeve, handkerchief. Wash your hands. Wash your hands. Wash your hands. Wash your hands. We tell you not to touch your face. That's really, really hard to do. But if you do, try and wash your hands or hand sanitize. But it's basic hygiene.
Shell wants to know, are people with type O blood not prone to get COVID-19? True or false?
Yeah, that's getting that question a lot. Just like with some of the other data, it doesn't inherently make a ton of sense. I'm not going to say that we know for sure one way or the other. The information on COVID-19 is coming in like fast and furious. There's, like I mentioned, the anti-inflammatory data. When it first came out of Europe, it was like, oh boy, nobody take ibuprofen. And now it's like, maybe that wasn't totally right. Do we give people steroids, when they're starting to get in trouble with their lungs, or don't we? So a lot of that stuff we're not totally sure about yet. The blood type was an interesting article. It wasn't exactly the most scientific study in the world. But again, most of our data we're getting is all kind of looking back, not trial-based. So that remains to be seen. But I can't give you a thumbs up or thumbs down on that one.
Sure, understandable. Another question on Facebook is talking about, should we get an air purifier? How much does that help?
It'll help with allergies. From a coronavirus standpoint, that's not going to help that much. As we know right now, coronavirus is respiratory droplets. So, mucus, you're coughing up, secretions, and keeping those out of the air and off of surfaces and off your hands and off your face. Purifiers for allergies, sure.
Dana wants to know, does a small slight cough and headache, is it allergy related? Could it be something else?
No, it could be allergy related. It could be influenza. It could be strep throat. It could be coronavirus. It could just be postnasal drip from something chemical you sniffed in from your garage. It could be a lot of different things. So just pay attention.
For sure. Lindy here, and I apologize, I don't know how to pronounce this, but should people taking DMARDs, I don't know if you say it, the letters or how you say that, avoid their injections at this time if they're staying home?
So a good question. Those are called disease-modifying agents for rheumatic disease. So patients that have rheumatoid arthritis or lupus or psoriatic arthritis that are on medications to modify their immune system response, because in those disease states, your own body is attacking you in certain areas. So the recommendations are do not come off of those. As a matter of fact, and don't take this and run with it, but as a matter of fact, some of the medicines we're looking at for coronavirus do similar things to those, because there's a thought that it's the immune system response to the lung infection is what's causing the majority of the problems in the people that get in a lot of trouble. So no, don't stop any of your medications. Talk to your doctor about it. The nervousness there is that those patients have a blunted immune response. So in theory, they're more susceptible to infection. But in this case, don't stop it. We're all quarantined anyway. But if you don't feel good, though, again, tell your doctor.
Anita on Facebook says, is it possible an RSV test on a child that comes back positive could have been the coronavirus? She had a temperature of 103.5 for 3 days back in January and was sick for about a week.
No, it sounds like RSV. Now, we are having some co-infections, we're calling it. So not only do you have coronavirus, but you have influenza, RSV, parainfluenza virus, there's a rhinovirus, a whole slew of other viruses you can have that are around every year. Could that have been coronavirus? It could have been. I'm not going to say no, but if you had a positive RSV test, it's most likely to be RSV. If she didn't get better after the RSV, then I would think that maybe there was something else going on too. But that sounds more like RSV.
All right. Mary Jane wants to know, is there a good temperature to keep your house warmer or cooler for this virus?
No, good question. So there's some data that suggests that warmer temperatures can inactivate or weaken the virus, but you're talking temperatures in the 80s. So that's why we're hoping for a hot summer. Other countries that have warmer temperatures at the moment aren't necessarily seeing the spikes that everybody else are. But from a housing standpoint, I don't, unless you want to keep your house at 90 degrees, which I wouldn't recommend.
No, I'm one of those that wants to keep it as cold as possible. Another question here on Facebook, and again, if you have questions, please pop them in the comments section. Dr. Shina, Carolyn wants to know, any thoughts on why Mahoning County is highest in COVID deaths?
I know we have a lot more cases, and I know we've had a significant amount of deaths. I don't know if we have the highest death rate per se, but you got to understand that a lot of these numbers are skewed. No, we don't have the healthiest population in the world, but we're doing a lot more, testing. We have very good protocols. So I'm on hospital rounds this week. I'm seeing it every day. There's not body bags being wheeled out the door every day, but it is a significant problem. It's getting worse every day. That's very true. But we have a good playbook for it. Again, people are still getting into trouble, and yes, there have been some deaths, but the more testing that we have, those numbers are going to get bigger. That we're going to have more deaths. We just are. It's the country has a lack of resources right now. It's not just Mahoning and Trumbull County right now, but so I would say that data's skewed some, but we'll see what happens in the next couple of weeks.
Marlo says, persistent dry cough with a scratchy throat. How concerned should I be with that?
Cough is the second most common complaint in the primary care office, in the country for the last, 50 years running, I think. So, concerning, it depends. I have a lot of questions, but that we're not going to have time for right now. But concerning if you add more symptoms to it, if now all of a sudden you're telling me, oh, now I got a fever, now I feel like I got hit by a truck, and now I can't breathe, yeah, I'm concerned. Consistent dry cough, it could be medication induced, it could be acid reflux, it could be, a variant of asthma, postnasal drip. Those are the most common causes.
Polly asked the question, if we have a doctor's order for the test, where should we go?
So on the outpatient setting, Quest and LabCorp are doing most of those. The problem is, from what I understand, the labs themselves aren't doing them. They have to be done in the doctor's office if they're even doing them. There are some testing sites in the area. The hospitals themselves are using the Department of Health for patients that are actually admitted and are in a little bit of trouble. I heard yesterday that one of the labs may be opening a center near Pittsburgh so we can get a better turnaround time on the testing. But that's been a limitation for us too, especially on the outpatient side. But to actually say, somebody mentioned Southwoods may be doing them. I talked to somebody today. That may be a resource, but the hospitals aren't going to do an order from a physician to get it done. The doctor's offices can do them via the labs.
Right, and just today, Governor DeWine mentioned an executive order was signed where test results are now going to go to local hospitals to try to get these results back quicker. I think a lot of people are really been uneasy because of how long it's been taking to get these test results.
Well, the problem is, and it's not, the labs, they have the kits, they don't have the viral media to spread it out on, they don't have the reagents to mix it with to get the test, turned around. And so we're seeing an average of 7 to 9 days, on the outpatient testing side. And by then, I mean, if you're not in trouble, you're probably going to be fine. And anymore, because the symptoms have become we kind of know what we're looking at now. The test is more helpful if it's negative than anything. I know some employers want to see if you have a positive test or not for self-quarantining and things like that. But yeah, 7 to 9 days it doesn't help, but.
All right, did we lose your mic again, Dr. Shina?
No, I'm here.
Oh, there you are. Okay. All right. Shelley says, what about fluids? Should we stay away from ice cold drinks? I was just diagnosed with acute sinus infection, but I do have loss of smell and taste. Could have a mild case of coronavirus. Wonder if I should sip on warm drinks instead of cold.
No, I mean, it really doesn't. If it soothes your throat, you go ahead. But no, really wouldn't matter one way or the other, really.
Okay. Melissa says, I tested positive for influenza A on February 26th. Still have a hard time breathing. Could that have been COVID-19?
If you tested positive for influenza, you at least had influenza. Some of the co-infection that I talked about earlier, the majority of patients that have coronavirus that had another infection, the majority of those second infections were influenza. So is it possible you had both? Yeah, sure. And if you feel short of breath, you'd hope you told somebody and got checked out.
Right, exactly. A lot of great questions here on Facebook. Thank you so much for everybody that has chimed in and asked a question for Dr. Shina. Doctor, I want to give you one last opportunity here. Just what's your message to the community? What would you like to say as we continue to really fight through some difficult times?
What I'm telling my patients, my 2 rules are, don't panic, try not to be a part of the problem. These are really strange times right now. So basic hygiene, keep your hands clean, cough and sneeze in your sleeve, stay home if you're sick, especially if you are sick. But on the flip side, pay attention to your body. If you feel like something's off, you got to let somebody know. Don't wait. Those are people that tend to get into trouble, and you'd rather err on the side of caution and call me every day than wait a week because you don't want to bother somebody and then you're in the hospital next. So pay attention to your body, but don't panic, and use some what I call medical common sense with keeping your hands clean and coughing and sneezing appropriately.
Well, what a great segment. Dr. James Shina, thank you so much for your insight and your expertise. We appreciate you joining us tonight.
No, thank you. Happy to help.
All right. Thank you so much. And we appreciate all of you joining us here on Facebook, on the WFMJ Facebook page. We'll have much more on this coming up tonight on 21 News at 11 o'clock. Have a great night. We'll see you then.